My name is Raisa Wheeler, and this is going to be my bradycardic audio recording. I would go into my patient's house and I would introduce myself. I'm going to say, hey, my name is Raisa. Can you please tell me what's going on today? I'm going to wait for their response. I'm going to look at their eyes for Perla. I'm looking at their neck for JVD. I'm going to listen to their heart and their lungs. I'm going to check for PMS and pedal edema. I'm going to establish an IV, put them on a monitor and oxygen. For today's purposes, our identified rhythm is going to be sinus bradycardia. Once their rhythm is identified, the next step is going to be to see if the patient has any serious signs and symptoms. The serious signs and symptoms that we are looking for are altered mental status, chest pain, JVD, hypotension, and signs of shock. The patient just needs one of these to be considered serious. If no signs and symptoms, then you're just going to monitor your patient and observe them and transport them to the hospital. If you do have serious signs and symptoms, then you're going to start with your algorithm. The first step is going to be your 0.5 milligrams of atropine via IV bolus every 3 to 5 minutes to a total of 0.04 milligrams per kilograms, or maximum dose of 3 milligrams. If that doesn't work, you're going to move on to transcutaneous pacing. You're going to want to sedate your patient if you have time, but don't delay with sedation if your patient is unstable. To start pacing, you're going to place your pacing pads on your patient. Then you're going to turn your pacer to the on position and set your rate between 60 and 70 beats per minute. Once you have capture, set your current to 2 milliamps above the constant capture rate. Once all that's done, then you're going to start your patient on an epi drip at 2 to 10 micrograms per minute, and you're going to titrate that to response. You want to continue checking your vitals and, of course, monitor your patient and continue taking them on to the hospital.